could we do behaviorally, psychologically, medically in order to offset this problem with strong emotion? Well, the first one is obvious, and that is to start thinking about our life and do we find ourselves in situations repeatedly that keep giving us these provocative emotional events? If so, and there's something common about them, can we take steps to avoid that situation? And so we need to think a little bit. This is kind of a contemplative, reflective forethought about what is bringing out our strong emotion in certain situations. And could we choose to change those situations in some way, alter the context? The second thing is we find ourselves already in the situation and the provocative event is occurring. So, what can we do then? We can interrupt our attention, distract ourselves, look away, look up, cover our eyes, look down, or in some other way, go to our happy place, if you will, but distract ourselves away from this provocative event by distracting ourselves or precluding looking at it by what children do, cover their eyes, close their eyes. Then we are terminating the connection to the event. And hopefully, by doing that, we will get control of our emotion faster. The emotional expression will run its course more quickly, and then we can get control of it again. So, sometimes what we can teach people to do or teach ourselves to do is how to distract and otherwise preclude continuing attending to the provocative event. It's not always easy, but it can be done in some ways. A third way of intervening is at the next step of appraisal, where while we can't necessarily intervene with the subconscious aspect of emotional evaluation of an event, this appraising that our brain does so quickly, that fight or flight reaction, we can use the executive brain on top of that to reappraise the event. Is it really that important? Is it really that negative? Is it really that problematic? This is where cognitive behavioral therapy comes in. So I'm not going to go into that in any detail, but cognitive therapists focus on this stage of getting you to track your thoughts, track your appraisals, and change the way you think about things. And by altering the way you think, what you say to yourself, and how you think about the event, you can alter your subsequent emotional reactions to those events. So that's kind of the third thing you can do. The fourth thing we can do is to try to suppress the event. We see children doing this when they sit on their hands, when they cover their mouth, when they close their ears and look away. They're trying to suppress the expression of the event. It's not very effective. This is a very difficult stage to do because the emotion's been elicited, and now we're gritting our teeth and we're clenching our fists and so on. But it is certainly something that one can do. And by the way, this is where medications come in. The ADHD medication, stimulants, non-stimulants, antihypertensive alpha 2 drugs, all work in one way or another to affect the limbic emotional brain and thereby alter the expression of the emotion or even make it a lot less likely that it's even going to be elicited. So medical intervention can take place here as well. And then finally, of course, we can alter the emotion by altering the consequences for it. Now, this won't change the current emotion. But by changing the consequences that follow that emoting, we are altering the future probability of that emotion, either increasing or decreasing that. This is a little harder to do. This is what behaviorism does by altering contingencies, altering consequences, behavioral interventions, such as we do with oppositional children, are trying to alter the future likelihood that that event happens again. So you can see then that there are at least 5 different steps at which an individual could intervene if they're having difficulties with emotional dysregulation or what I call emotional incontinence.